Okay, Brittany, tell me what's going on with your jaw.
So, my right jaw is extremely tight. When I tried to open it, it doesn't open wide at all. It's constant aching.
Okay. How much pain do you feel there from 0 to 10? 10 is emergency room. At worst.
Emergency room?
Yeah.
I would, not emergency room worthy, but it does hurt a lot. I would say maybe like 7 or 8.
7 or 8. Is that constant pain or just when you do certain motions?
Certain motions, like opening my mouth too wide or closing it when I'm eating.
Okay. And how long this been going on?
Since end of June.
End of June. We are in October, so it's about 4 months now. Okay. And what kind of treatment you had for this before?
I've been using a mouth guard.
Okay.
That's really all I've been doing.
Okay. So would you show me where is the pain exactly?
So the pain is when I open my mouth.
I think I have your jacket.
It's here.
Okay.
And sometimes, like when I bite down,
Okay.
it can sometimes even go up to here.
Okay.
And then maybe because I'm clenching at night, in the morning I feel a tightness in my neck.
Tight in the neck. Do you have any headaches or anything like that?
No.
Okay. And you said now it's how much from 0 to 10? How much pain?
About 7 to 8.
7, 8. Okay. Let me see your neck range of motion. Go backward. Okay. And let me know if you feel tightness forward. That's not too bad. Okay. Turn your head to the right. Left. Okay. Side bend to the right and left. Did you feel any pain with that?
This side I don't feel any pain. This side I don't feel any pain, but it does feel tighter.
Okay, all right. So I'm gonna take the range of motion for the jaw, just to get the side shot. Okay, can you hold this, please? Okay. So, make sure to get those numbers. Sorry. No, this way. Okay. It's open. But as far as you can go. So that's basically 20, 23. Can you see that? It's like 22, 20, 23. Okay. So you've been having that limited range of motion since last June, 4 months now.
Yeah.
Okay. So make sure you let me know if you feel any pain, okay?
Okay.
Let's line your back, head here.
Head here.
Yeah. So, yep, no problem. Okay. So, any pain with this? So this is the area you're talking about, yeah? In here? Is that painful? Okay. Yeah, your mouth opening is very limited. The normal is 35 to 45 millimeters. You're like 24, 23, 24. You did not notice.
On the right side.
Is it painful?
What you just did, I feel that. It wasn't painful. It felt like,
Tightness?
yeah, I felt like you were massaging it. It felt better.
That's good. Yeah, this is called ASTR. It's better than massage, okay? Yeah. Let me know if that's too much. Yeah. Make sure it's not So since June you are limited the same exact range of motion, or it was gradual decrease in the range of motion? Was gradual or just happened like suddenly?
It was gradual.
Okay. Is it too much here?
No, it's fine.
Okay. You said the side is okay. You feel this bump here? Okay. Is this painful here?
No.
Okay. Make sure you let me know if you feel any pain. So you said it's difficult for you to eat, open your mouth, chewing.
Yeah.
Okay. What about talking?
No, talking
Talking's
is fine.
fine. Okay. Let's see. And you don't get headaches, yeah?
No.
Okay. How does it feel here?
Feels a little looser.
Looser, yeah. I'm gonna work on scar tissue, you know, if it's too much, okay? There's some lotion and you'll feel a little bit cold.
Okay.
Alright. You feel this bump here? It's a scar tissue, and you feel this grinding here. It should feel like nice and smooth like this. You feel how nice and smooth that is? Yeah. That's, you don't have a scar tissue there in this area, but here, and even like in the camera you can see it's not moving. Here it's moving nice and smooth. Here's just the scar tissue prevented from moving. So
Wow.
yeah, is it too much or it's okay?
That's fine.
Yeah, that's because you're clenching, so you're grinding, you start to have a micro tear in the muscle, and that micro tear causes scar tissue, and over time that those big knots cause restriction in range of motion, because the muscle should act like a rubber band. When it contracts and relaxes, it does this. So when you have a scar tissue, it's like you have a knot in a rubber band. So when the muscle contracts, it does not have enough room to move. So it compresses on nerve artery, could compress on nerve artery or joint, and decrease limited the range of motion. Is that too much?
Yeah, it's okay.
And I'm gonna break it that closer to your TMJ joint. Is that too much here? You feel that bump here?
Yeah.
It's all on this side here.
How do I stop clenching at night?
I will go over that with you.
Okay.
We have like a lot of tips that can help to stop that. A lot of patients they use those tips and they were able to actually stop clenching at night. So we'll go over that in detail after the video.
Okay.
Yeah. So the treatment is just doing the release, and I'm gonna show you some exercises afterward. We're gonna go over a list of stuff that I want you to work on to help decrease the clenching. Hopefully, some patient can stop clenching actually after following this instruction. It depends. There's a lot of factors for that, so we'll talk in detail about that. Is it too much?
It kind of tickles.
Tickles? Yeah, it's fun to be here. That's good. That's good. You feel this bump here? Because you said it's here in your neck too. And take the measure again. Strap nice and tall. Okay, beautiful. That's like 29, 30, almost 30. It's good.
Wow.
Yeah. So let me do one more thing. Let's see if we can get more. Okay. We'll start with 23, 24. Yeah, heavy here. Yeah.
Oh, on my back? Yeah, it was like 22.
Yeah. So that's not too bad. Okay. So let's go toward me. But you had this for 4 months. It's not was last week. That if I see the patient like when they have limited range of motion, a few days or a week or something like that, that's usually we can get the range of motion much faster. But if it's for several months, you got a lot of restrictions in different areas that make it make it more. There's more areas that need to be worked on. Is that too much?
No.
Okay, so I can do this. It's too much tightness here. You feel that tightness? You feel how it's pull your head? I'm just trying to release the fascia and your head is moving with it. That's from the tightness. Sorry. Okay. I'm not pulling her hair, okay? Look like that.
No, this side wasn't as tight.
Yeah, as this. You feel all this like.
Yeah.
Sorry.
It's okay.
Make sure you smile. It's the camera. Yeah, it's not torture, okay?
No.
It's, it should be
It's a
comfortable.
good pain.
Well, I don't think it's a good pain. I don't think pain is good. Just
But it's
if you
like-
feel it stretching, that's fine.
It's like a release type.
Release, yep, that's a good way of describe it. But I disagree with the painful philosophy, because if you have pain, it's like you have a check engine signal in your car. So there's two options when you have a check engine signal light on your car. One is cover the signal and just keep driving and hope for the best. Two, just figure out where the pain coming from and fix it, and the check engine light will disappear. That's the same thing with the painful signal on the body. If you ignore it and you keep pushing it, you really don't know what's going on, and you don't know what's gonna end. Is it gonna cause more damage or not? But if we start to evaluate and figure out why there's pain to begin with, we just get to the source of the problem and the pain should disappear. So that's why I disagree with the painful philosophy. You're not making faces now, are you?
No.
So, okay. You have fascia restriction, it's like you're wearing a t-shirt 2 to 3 sizes too small. So let's say this is a fascia, this is a muscle, this is joint. I don't have any fascia restrictions here. So when you have fascia restriction, it's like you're wearing a t-shirt 2 to 3 sizes too small. So when there's tightness like here and I try to move my joint, it limits the range of motion. That's exactly what fascia does. It compress on nerve artery, could compress on nerve artery and limited joint range of motion. So that's why practitioner, that's why I have to work on that. It's part of the problem. Fascia restriction, scar tissue, trigger point, muscle spasm, and we have to address it holistically to make sure we're treating everything, not just part of the problem. Is it too much?
It's okay.
Okay, so let's actually try to. How's your neck now?
Feels good.
Any pain, discomfort?
Mm-hmm.
Okay. All right.
My neck feels great.
Okay, awesome. Okay, let's open. Okay. So it's it's about the same. Okay. 29, almost 30. Okay. So all right. So tell me, what do you think about ASTR treatment?
Yeah, it went from 22, 24 to almost 30, so
Yeah,
definitely
that's-
helped a lot.
Yeah. Thank you so much.
Thank you.
Thank you.